Hi, good morning, everyone. Can you hear me? Great, thank you. So I want to welcome you to our session this morning. My name is Nicole Lawrence. I'm a senior research scientist here at the Center for Child and Family Policy. And before getting along and introducing our guests, I wanted to just share some brief logistics with you. Our panelists, first, each of our 4 panelists will have 8 minutes. And after that, we should have about 20 minutes left for questions. So we encourage you to submit questions via the hop-in comment function, and that should be on the right-hand side of your screen. And you can do that at any time during this presentation. And the goal is for us to get to as many questions as we can before the end of the session. So I'll go ahead and get started. As Dr. Darrow highlighted, that our most current early childhood policies are based on the idea of offering targeted services to a limited population of at-risk families or based on income qualifications. She's challenged us to sort of reimagine a more universal system of care that recognizes common needs and aspirations for our, that parents have for their children across all children, and sort of our collective responsibility to meet those needs. So in a bit, we're going to do that. But before that, we're going to take some time during this session initially to examine how well our current early childhood policies are working. So I'm thrilled to introduce our panelists who are going to help us tackle this question. So our first presenter is going to be Dr. Anna Gassman-Pines. And she's an associate professor at the Sanford School of Public Policy, as well as an associate professor of psychology and neuroscience here at Duke University. So as an affiliate of the Center for Child and Family Policy, her breadth of research has focused on low-wage work, family life, and the effects of welfare and employment policy on child and maternal well-being in low-income families. Most recently, her work is focusing on the family experience throughout the COVID-19 pandemic. So next, and I think I'm supposed to introduce once, is that correct? And then does Anna move into her presentation? Okay, so our next presenter after Anna will be Dr. Carolyn Barnes. Dr. Barnes is currently an assistant professor at the Sanford School of Public Policy here at Duke, and her research explores the social and political implications of social policy on underserved low-income populations in the areas of child care policy, family services, and supports for young children. As an affiliate of the National Poverty Center, her recent work focuses more on the possible impacts of policy on parenting practices and the psychological well-being of on parents and their children. Our next presenter will be Yvette Sanchez Fuentes. Ms. Fuentes is the vice president of a national policy organization, Start Early, Champions for Early Learning. Her professional history spans a breadth of child care policy involvement, including having served as the associate secretary for the Department of Education, the deputy chief of public policy and research at Child Care Aware America, and an early child care policy consultant for 28 years. Her extensive experience has focused on resource expansion, policy development, and education for underserved families and their communities. And rounding out our panel is Dr. David Willis. Dr. Willis is a senior fellow at the Center for the Study of Public Policy, where he works to advance the growing intersection of child health with other community supports for young children and their families. Dr. Willis has decades of experience working to support early childhood systems and developmental health. Early childhood systems and developmental health trends that can be seen today as he applies pediatric care to the broader early childhood system. So again, I want to thank everybody for joining us, and we're going to start the presentations with Dr. Gassman-Pines.
Thank you so much, Nicole, and thanks to all of you for being here. I'm going to spend some time today talking about research that I've been conducting with Dr. Elizabeth Amanat from Barnard College, focused on the experiences of low-wage service workers with young children during the COVID-19 pandemic. And I'll be talking about low-wage service workers today, but in many ways, a lot of the experiences of that particular group of parents have actually been felt by parents working in all different types of industries and at different income levels. But I'll focus today on that particular group. Excuse me. So why study service workers with young children? Service workers with young children are where the conflict between the ideal worker, who is always available for work and doesn't get paid when not needed, and the laissez-faire approach of the United States towards how families meet their own care needs reaches arguably its most unnavigable point. Labor activists have been making this argument for years, but policy responses have been, excuse me, minimal and piecemeal. But in the meantime, service work has continued to grow as a form of employment. So this blue line here shows the trend in service work over time. It's gone up, while work in the manufacturing sector, for example, the red line, has decreased. Service work is characterized by high levels of unpredictability and instability in work schedules, and therefore in take-home pay. And research in both child development and family studies suggests these aspects of work pose risks for both families and children. So policymakers have been actively intervening in characteristics of these jobs because of public concerns about risks to the well-being of workers and children. And these include so-called schedule stability laws passed in a number of localities, including San Francisco, Emeryville, California, Seattle, Chicago, Philadelphia, New York City, and the state of Oregon. So this is the backdrop of what was in place prior to the pandemic, and kind of a setup for thinking about, well, what happened to these families during the COVID-19 pandemic. And what I'm going to share with you today about these families' experiences is just a set of lessons learned from data that Dr. Anana and I have been collecting throughout the pandemic, but I would welcome questions about these specific findings as well as any others during the Q&A, and look forward to talking with my fellow panelists about them as well. The first finding that I want to share is that the initial COVID-19 crisis was a very hard time for working families. We were following families using daily surveys at this period of time, and things were looking relatively flat right up until the moment when everyone realized that the COVID was a serious public health emergency, and state and local governments began implementing restrictions such as stay-at-home orders, the closure of public schools, and restriction on operation of non-essential businesses. And when those restrictions put into place, families in our sample immediately lost access to work. That's the the orange line here. But also family mental health declined quite largely, and immediately following those initial restrictions. Although employment has increased as the pandemic has persisted, and that can be seen here in the blue line, many parents remain either unemployed or out of the labor force altogether. And that is likely because of the challenges regarding school and childcare that families have had to endure during the pandemic, making it even more difficult to balance both work and care responsibilities. These ongoing difficulties have been unevenly addressed by policy remedies. So this is one example from the summer of 2020, and looking in particular at unemployment insurance, which is one of our main policy tools for addressing lack of employment. In our sample of the workers who were laid off, the vast majority tried to apply for unemployment insurance. So 87% tried to apply for unemployment insurance. Of those who tried to apply, the majority were able to get through the process, though not all. So not everyone who tried to apply actually completed the process. However, of those who successfully applied, at the time that we surveyed them, just under 2/3 had actually received an unemployment insurance check at the time that we surveyed them. And furthermore, of those who received a check, not all had received their expanded pandemic unemployment compensation to which they were entitled. So as you kind of think about each of these steps in accessing a policy support, fewer and fewer families made it through each step, such that only about half of the laid off parents in our sample had been able to get their full unemployment and pandemic additional benefits at the time that we surveyed them. And furthermore, different families with different characteristics had different experiences throughout this process. So in particular, our Hispanic families were less likely to apply for unemployment insurance, presumably either because they were unclear about whether they were actually eligible or because of fears about public charge and other concerns around immigration issues. And then in our sample, of those who successfully applied, the Black parents in our sample were substantially less likely than the white parents to have actually received their unemployment insurance check at the time of the survey. And this is consistent with larger nationally representative surveys that have found that Black workers wait longer to receive their unemployment checks than do white workers. Why don't these benefits that were expanded and made more generous during the pandemic reach everyone? There are several potential reasons. One is applications themselves were designed to create hurdles to receiving benefits. Those hurdles were placed in non-pandemic times, but remained even during the pandemic when families were facing so many more challenges. The systems themselves are antiquated and often cannot be updated quickly or easily to eliminate those hurdles or to otherwise enact more reasonable new policies. And many offices are chronically understaffed. We also found that food insecurity increased during the pandemic and then decreased as more generous cash assistance became available. So on the far right of this figure, food insecurity in our sample fell to even slightly below pre-pandemic levels by summer of 2021. And that could be largely driven by the fact that the new pandemic child tax credit had rolled out in July of 2021. So this was a regular, for a 6-month period, a regular consistent source of additional income for all families. That seems to have made a difference in terms of families' food insecurity. And that's true in our sample, but is also consistent with nationally representative data from across the country. And finally, we have found in our study that the pandemic has taken a severe toll on mental health. So in the fall of 2020, nearly half of the parents in our study screened positive for either major depression, generalized anxiety, or both. 17% of parents reported that their children are sad or worried the majority of the time. And we find evidence that a very chaotic schooling and care situation in the first half of that pandemic school year was likely a significant driver of mental health challenges, in addition to loss of employment and material hardship. So the implications of these findings taken together are that overall that continued supports for working families are needed. In terms of work and income, generous assistance during the pandemic did help stabilize families. And we should be having a conversation together about ways to continue these types of assistance post-pandemic. Additionally, more attention needs to be paid to ensuring that all families, but especially families of color, receive benefits to which they are entitled. In terms of mental health and other supports, we need to be thinking about strengthening systems addressing family mental health and investing in additional family supports, and looking for additional ways to invest in and support schools and childcare centers. So to conclude, the effects of the COVID crisis on hourly service workers with young children on work, income, and well-being were immediate and striking. And these effects on families have persisted as the pandemic has persisted. Policies aimed at providing income to families during the crisis helped, but their reach has not been universal. And little attention has been paid to family health needs and interventions that are needed to support family mental health. So that additional supports, public supports, will help families in need both during this ongoing pandemic and as we hopefully move out of it in the future. And I will just conclude by thanking the tremendous number of funders and staff who made this work possible. Thank you so much. And I look forward to a wonderful conversation.
Okay. Hi, everyone. That's the worst thing that can happen. You can start talking and you're muted in a big conference, but I'm Carolyn. I'm an assistant professor at Sanford, and I am doing a bunch of work now on the intersection of SNAP, WIC, and Medicaid at the state level, and started this project years ago and sort of tracked how low-income families are accessing major safety net programs like WIC and SNAP during the COVID-19 pandemic. But before I get into some of the findings, I wanted to thank some folks that were really instrumental in implementing this study. So Mary Ann Bergart from North Carolina's Department of Health and Human Services, Cardra Burns, Liz Weiner from the Weiner Family Foundation, Mary Davis from the Blue Cross Foundation, and Joshua Crossman were instrumental in funding and supporting the study. We did a large scale qualitative study across 6 counties in North Carolina that really tracked how workers were impacted by COVID-19 and how families that would be eligible for WIC and SNAP were impacted in terms of access. So some of the insights that I'll share today piggyback off of what Anna was talking about in terms of systems being complicated and the application process being complicated in limiting access to vulnerable families. So the key questions going into the study were, what are the barriers to accessing, maintaining, and using WIC and SNAP, and how has COVID-19 influenced WIC and SNAP access? So before the coronavirus, myself and a research team were in the field trying to understand existing barriers to nutrition assistance programs like WIC and SNAP. And sort of the perennial challenges with WIC were, making sure families could make appointments and making sure the shopping experience was easy and positive for families. So with WIC, the key barriers prior to COVID-19 was the challenge of in-person appointments and the challenge of redeeming benefits in grocery stores. With SNAP, there are similar challenges in terms of having to conduct an interview, fill out a complicated application, having to fill out an application to recertify your eligibility for benefits every 6 months. Those were kind of key barriers prior to COVID-19. But with the coronavirus, we see this incredible sort of watershed moment in social policy where through legislation and policy waivers at the federal level, we see a lot of these features of these programs shift to make things more accessible and more generous. And so with WIC, we see remote appointments in lieu of in-person appointments and the capacity for WIC participants to self-report a lot of the measures that are used to determine eligibility. We also see the introduction of food flexibilities, which is designed to sort of ease the shopping process and help WIC participants navigate some of the supply chain challenges and shortages, food shortages that they were experiencing early on in the pandemic at grocery stores. With SNAP, we see a whole host of COVID-19 policy changes that are designed to ease the burden, the administrative burden of accessing benefits. We see the introduction of remote interviews, the capacity for SNAP applicants to self-report income information instead of having to submit a bunch of documents. We see the extension of recertification deadlines, which essentially gave SNAP participants a year's worth of eligibility. We see the introduction of emergency allotments, which basically topped off households that weren't receiving the maximum benefits. And we see a pandemic EBT for school-aged kids that were eligible for free or reduced lunch. And at the same time that we see all these major COVID-19 policy changes, we also see online purchasing as an option for SNAP participants at Walmart and Amazon in North Carolina. So the question, if we revisit the key questions that were mentioned a couple slides ago, the question is, how have these changes shaped access for WIC participants and for SNAP participants? So what we find for our WIC sample in their COVID-19 experiences is that a lot of folks really enjoyed these remote appointments. They viewed remote appointments as being more convenient. However, a lot of our participants were unaware of the program changes that were designed to make access easier. So of all of the folks that we interviewed across these counties, only 27% of the WIC participants were aware of these food flexibilities that were designed to make redeeming their WIC benefits easy. And most of the WIC participants that we spoke to, they still reported a bunch of challenges when they were trying to use their WIC benefits to purchase WIC-approved foods. So it seems like there was something lost in translation, especially early on in the pandemic, that made redeeming benefits difficult. So WIC participants benefited from the remote appointments. They viewed them in a positive light and evaluated them as being more convenient, but they didn't necessarily benefit from the food flexibilities in the ways that we had hoped, in part because they were unaware of food flexibilities and still had challenges purchasing WIC-approved foods in stores. We see a similar pattern with SNAP. So our SNAP participants were also unaware of these major COVID policy changes that came about that, again, were designed to reduce the burden of accessing and maintaining SNAP participation. So 25% of our SNAP sample were unaware of deadline changes. So they did not know that they had an extra 6 months of eligibility and they didn't have to go through the recertification process. Many of the folks that we talked to had already prepared recertification documents. They were already prepared to resubmit their information for fear of losing their SNAP benefits. So they were paying the cost or experiencing the burden of maintaining SNAP eligibility that they didn't have to. They didn't have to, all because they were unaware of the fact that they had an additional 6 months of eligibility. Only 20% were aware of the maximum benefits. So 20% of our sample reported benefiting from additional emergency allotments of SNAP. Only 33% were aware of online purchasing. So most folks didn't know that they had the option of using their SNAP benefits at Walmart or Amazon. And of the few that did know, that were aware, they didn't understand how to use that feature. They didn't know how to take advantage of that option. But 80% of our sample were aware of the pandemic EBT program. And we attribute that to the fact that the school system was often sending out information to parents about the pandemic EBT. So there were multiple ways in which folks would be learning about these policy changes. We also found, surprisingly, that telework, so the option for SNAP participants to do those interviews remotely, telework did not actually make workers more accessible to SNAP participants. So 60% of our sample reported negative interactions with SNAP workers. And the chief complaint was they had difficulty contacting workers. And this was most prevalent in our urban counties, where 75% of the respondents reported difficulties. So this meant if someone was trying to apply for SNAP benefits and had difficulty reaching a caseworker, that complicated their capacity to apply for benefits. This meant if someone wanted to report changes to their household or changes in income, it was difficult to contact workers to do that. We had instances where folks had lost their SNAP benefits during the pandemic and was unable to contact their worker to restart or recertify benefits. So this really posed a huge challenge for a lot of our folks in our sample. And this negatively impacts food insecurity. So in addition to sort of the economic fallout, of COVID-19, prompting, food insecurity due to job loss or shortened hours or food shortages or needing to stay home because of remote learning. Limited access to SNAP throughout the COVID-19 pandemic. That also led to some experiences of food insecurity in our sample. And we find that food insecurity was equally prevalent across urban and rural counties. And I just got the time flag. So I'm going to stop here. Thank you for your time.
So hello, everyone. Good morning. Buenos dias. Thank you so much for joining today. My name is Yvette Sanchez Fuentes. I serve as the Vice President for National Policy at Start Early. And so just really excited to be a part of this conversation. I'm going to chat a little bit with you today about the impact of early care and education and family supports. And I think as many of you know, early care and education, as well as childcare, have really gotten on the radar throughout the COVID-19 pandemic, and particularly over these last 2 years. We know that families have a variety of options of how they can choose available care, early care and education, anywhere from center-based to family childcare to staying at home. But it's really up to the family to determine what works best for them. But one of the things that we know about how families choose is what's available for them. I would also just share that I think that we've also learned, and I think the general public has learned particularly, right, that early care and education and childcare is really not just about the 1, 2, 3s and the ABCs anymore, as we used to think, but it's really about providing these comprehensive, holistic supports for the entire family, because we know that when we're working with young children, that kids really develop within the environments that they are in, whether it's at their early care and education and childcare setting, or wherever they're at home, or when they're not in care. And we know that much of what happens for kids is impacted by the adults. And so we know that if the adults are not doing great, then our kids are not doing great. And I think you've heard some of that and seen some of that just in the first 2 presentations here. So one of the things I just want to talk about very simply today is that we know that early care and education programs really provide supports to families in 3 primary ways. The first is practical support. So this is help with the day-to-day realities of parenting and functioning. And I think we've all sort of experienced that, especially those of us who have young kids at home or who have had new babies over the last 2 years, really trying to juggle all of these new realities that we all have to face. And we know that our early care and education programs really support families and just trying to figure out, how do you set up routines for kids? How do you make sure that kids have easy transitions from home to care, and et cetera? The second is personal support. So how do we support the adults that are caring for the kids? And that could be anything from just listening to the adult caregivers, mom and dads or tias or abuelitas, whoever's dropping kids off, to hear how they are doing. But it could also mean helping to support them economically. So making the connections that those adults will need in order to be able to support themselves and their families. And the third way is obviously through informational support. So making sure that families understand, how do kids develop? Why do they do the things they do? If you happen to have a 3-year-old at home, why are they always asking you why? So making sure that families or adult caregivers really understand those pieces of what's happening for kids on a regular basis. So we know that our programs are really often, if they're only supposed to take care of kids, we know that that's not all they do. They take care of the entire family. And a big part of what they do, whether it's formally or informally, is to make sure that they're connecting families and the adult caregivers with the resources that they need in order to better support their families economically, with their health supports, whether it's mental health, behavioral health, and obviously also with anything else that they may need. We've heard from programs, and I think many of you have seen this as you've done your studies or interacted, right? Programs can do anything from helping families to help a child who's got some learning disabilities, to also helping a parent find a job or find a car or get groceries, I think, as you heard in the previous two presentations. So programs really take on this wide range of needs because we understand that that's the best way to support kids, both now and in the long run. But we also know that our programs are facing a lot of obstacles, and you've heard this over and over again, right? So primarily breaking these down into three major obstacles. So the first is around funding and resources, which you've been hearing a lot about. The second is around workforce capacity. And the third around rules and regulations. And there's a lot to unpack in all of these, but just want to give you some food for thought. So as you're thinking about funding and resources, so we know in the United States, we've got two major federal early childhood programs, the Child Care Development Block Grant and Head Start, which really serve our lowest income kids, depending also on what your state requirements may be. But we know that these programs are also underfunded, and we know that only a small proportion of eligible kids receive these services and these supports. We've also got our IDEA programs, Part C and Part B, which serve our children and families and our young children with disabilities. And we know from the Department of Education that these programs have been historically underfunded and are leading to states actually having some financial troubles with continuing to fund these programs at the levels that they need to be funded. So keep all that in mind, is that these folks are really doing everything that they can with minimal amount of dollars. As we're thinking about workforce capacity, everybody already knows this, right? We know that there are not enough people to work in early care and education and childcare. We know that people don't want to go into the field because it's not well paid, often not well respected. And that's just kind of the bottom line. But we also know that programs have to make choices with limited funding. We know that they got to make choices between serving the amount of eligible families that they can and probably raising salaries. And so we know that often programs are trying to create this balance of how do I continue to support my workforce, both professionally and also money-wise, and how do I continue to serve families in the holistic way that we know that families need to be served. And then the third, rules and regulations. Everybody knows, right? If you get a federal or state grant or you get any kind of money, you're always going to be, there are always going to be rules attached to that. And you're going to have to figure out how to make choices around who you want to serve, how you want to serve them, supporting your workforce, and aligning to those rules and regulations. But I will say this, one of the things that I've seen in my career, both in federal government and outside, and state government and outside of government, is that at the local level, programs figure out how to do this. We can gather a lot of information from them about how you do these things. And it's not easy, but they have to make it happen. So a couple of just sort of implications or practical ideas as we're thinking about this. So we know that sometimes government can help to solve these things. We know that many of the programs that we've been talking about this morning were all set up really in the 1960s, and they're set up for a reason, right? They were set up for a reason back then about how they worked. Today, I think it's time to start thinking about how do we change these programs in order to really think about how do we serve our families for today and for the future. Been hearing a lot of information about if we continue on the track that we're on and continue to serve families without changing anything of what we do, our families will only get worse into the future. And so really thinking about how do we use government to try to change these programs in order to make it easier for families to access, in order to support the workforce, and in order to really ultimately support our kids and families so that we're all really living in a community that supports us all. One of the things that we know is that at Start Early, we are really trying to think about how do you think about policy in a different way. We often think about policy at a 30,000 foot level because government is complicated. I mean, I think we heard from the two previous presenters just how hard it is for families to get information about how programs have changed or made it easier to increase access. But as you heard, many families couldn't even get that information. So how do we start to think about how we use government, support government in those public-private partnerships in order to make sure that families are getting the information that they need in the way that works for them? like I said before, we know that at the local level, programs have been figuring this out for decades. People can get really, really creative when they really need to, and when they see those families coming to their front doors, right, asking for services of any kind, whether it's early care and education, whether it's food stamps, whether it's housing. We know that families will come to the doors, and we know that the people who run them actually help them support that. So with that, one of the things that we do want to understand is we want to understand how government works. So we want people to get out there to understand what are the steps to making it easier. And we also want to hear from those that are being innovative. So if you know those people, please make sure that you're telling their stories and that you're helping them to tell their stories so that we can understand how to make this easy for all of us. And finally, we just want people to seize those opportunities in front of them so that we can take those innovations, we can implement them at the local level, we can change the policy, and ultimately we can make things better for kids and families in our communities. So I'm looking forward to the conversation, and thank you very much.
Hi, everybody. It's great to be with you today. I'm David Willis, a pediatrician. I'm a senior fellow at the Center for the Study of Social Policy. And I want to lean in further to what is shifting in a positive way policy landscape, despite the challenge of the COVID time and the disruption that this has created. In every moment of disruption and challenge is opportunity. And if we can come to the next slide, what's been striking during this next period, next slide, please, is in fact the major shift in public policy that has in fact occurred. We've seen the biggest shift in child and family policy in many years. 60 years ago was the war on poverty, 85 years the New Deal, and we're seeing dramatic shifts in policy that have, quite frankly, been designed to provide help to a wider array of families that some of our previous panelists were articulating. The American Rescue Act included policy changes that really were directly able to cut poverty in families, as was noted, and promote family well-being. And of course, these need to be made more permanent, but the fact that they occurred and the fact that they exist is moving forward in terms of the policy landscape. So we saw economic relief, including the tax credits to reduce child poverty. We saw health coverage and access grow in terms of an expansion of the community-based workforce that's growing, and the assistance of basic needs and family support around food, housing, home visiting efforts, and educational investments in IDEA. These are really important moments of change in positive directions. Of course, the devil's in the details, and still many of these policies have to be made further permanent, certainly the child tax credit, but the dollars that are coming out into communities around building an infrastructure of relational health supports and community health-based workforce and other assistance is really striking. Next slide. Now, I'm a health child person, a pediatrician, and the policy statement that came out in August from the AAP about preventing childhood toxic stress by partnering with families, communities to promote relational health is absolutely a policy game changer. And I want to read and quote the first paragraph of this report that came from AAP, multiple policies and committees within the organization. By focusing on safe, stable, and nurturing relationships that buffer adversity and build resilience, pediatric care is on the cusp of a paradigm shift that will reprioritize clinical activities, rewrite research agendas, and realign our collective advocacy. So this moment in time, in the middle of the changing landscape as a result of COVID and the many needs we have about families being first experiencing that sense of isolation, the culture being aware of the crisis of connection, and every sector being aware in the COVID moment of the need for connection, and this movement of health systems towards being far more focused upon relationship building is a critical moment of change that's moving forward. Next slide. And that's what we've captured as this movement of promoting early relational health. I'm at the Center for the Study of Social Policy. We have an early relational health coordinating hub that's really focused on building a relational health movement, not just as a new concept. This is a new concept, but maybe a new term to some of you, Early relational health builds upon decades of research from the fields of child development, infant mental health, and neurodevelopment, and it focuses on the centrality of relationships, the relationships between caregivers and young children for their future health, well-being, and social well-being. But it also calls out, how do we support the contexts and the environments that strongly support families in their goals of the health and development of their children? So the movement in child health and public health is not about fixing parents, but it's about fixing the systems that disrupt the opportunities for building strong relationships that are the source of future health, development, and well-being. Next slide. And there are many policy implications, many of which are already moving. And I think that's what's most exciting. There's a clear equity awareness at every level across health sectors and the country that much more equitable supports for families, especially those of greatest need that have been up to now marginalized, has to be the key of our efforts. The health system itself recognizes that it's in a redesign effort to bring family voice and participation in creating more trusted relationships with families. Economic security is now critical. We know that poverty is the driver of so many disruptions, and the focus on child tax credit, the recognition that that is an economic need in our nation will likely continue and move policies forward in that direction. Similarly, we realize we have to be retraining people to be focused on relational efforts. We have to build further services that promote this relational health workforce effort. We have to be thinking about health system transformation that is already moving in so many ways. Some of the recent HRSA investments and the Medicaid policies that are opening up the opportunity to build team-based care models in healthcare are already present and can be moved forward to make perfect change. And certainly the connecting to communities that is coming out of some of HRSA's new early childhood systems grant, the early childhood health systems grants that are coming forward, all of which are calling out for the connecting between health systems and community, recognizing health systems are universal platforms for all families. Back to Dara's sense of, that universal effort of prevention really starts including a health system linked deeply with communities. All of this is about early childhood system building. Next slide. The policy landscape becomes really important to take moving forward this paradigm shift in health systems and community, those health foundations, relational health foundations of early learning, requires that we think about a two-generational approach. Like we've talked about, the well-being of families, the well-being of communities helps determine then the well-being of the next generation. Within all of that has to be our intentional focus at local, state, and federal efforts to tackle racism, poverty, and social determinants. And we're witnessing policy focus around all of these awarenesses that gives us a unique opportunity for change. Next slide is the current policy opportunities that have come forth under ARPA that have been important for this relational health framing, has been that recognition of the postpartum Medicaid support now up to a year of age. That means that women on Medicaid after birth have coverage up to a year. That can mean dyadic therapy, and the support efforts for the relational health of mother and baby is really a game changer of opportunity in the moment. There's also been dramatic shifts of dollars now into, I think it's 40 states that have pediatric mental health access lines to help families and young families that have mental health needs that are all focused relationally. And then there's an expanded investment into communities across this country that give opportunities for building out that relational health workforce of community health workers, doulas, and others, including expanding home visiting. And then, of course, that universal platform, that's a possibility. And then with the hopes of Build Back Better still in all of our minds, paid family leave, child tax credits, and this maternal health legislation furthering is really important. Next slide. And if we put this all together, we could begin to envision all these policy opportunities that come together in a family-centered community health system that we as CSSP have articulated. And in that is a focus on place-based effort to achieve population health, by a focus on coordinated, integrated, longitudinal, universal to universal targeted efforts for early childhood system effort in terms of engaging a high-performing medical home with team-based care that connects deeply to the communities. All of this requires strong parent leadership, networks that hold programs, services, and supports that really focus on equity and services and supports for all. It has to be an intensive, coordinated, and comprehensive strategy for all infants and toddlers that are relationally focused. And of course, family leadership becomes center to this effort. And again, policy spaces are allowing that to move forward. Thank you for the opportunity to be together. I look forward to our conversation. Thanks to all.
Well, I want to thank all of our presenters for your insightful overviews of sort of where we are right now as a country with some of the policies that are impacting children and families. So I want to direct, as we think about the challenge that Dr. Darrow put to us earlier, I'd love to sort of have us turn to this growing interest in universal policies and programs. And so I'd love to have give each presenter an opportunity to sort of provide, and certainly Dr. Willis and others provided examples of policies, but are there other examples of universal policies and programs within each of your areas that you think maybe hold promise for improving the lives of families that have young children? If there are things we didn't cover that each of you might want to address.
I would just start by saying that I think that while we definitely, universal coverage is a goal, we still always have to keep in mind those who are most impacted. And so I think often the challenge between targeted versus universal is that you want to make sure that those families who most need it actually get the services first before we build up towards the universal. So I think the challenge for us is, how do you make sure that there's enough funding in the systems or in the programs to make sure that those families who most need it first get the services, and then we ramp up towards the universal piece?
I want to lean into policies in states that are now moving forward with the Family Connects Universal Home Visiting model. That we have, I think, 6 states that are moving forward with that. Similarly, the doula movement that is happening in states that are perinatal supports for mothers that come out of community supports that are really focused relationally, that are deeply equity focused, that use the strength of social networks and connections and communities is a striking opportunity. And we have some states that are moving forward in that kind of effort. The opportunities from Medicaid for these kind of movements are really striking to continually lean forward on in terms of states. The last thing I would say is, remember, the health system is a universal touch point. And 50 to 60% now of babies are covered under Medicaid. And now that we have universal coverage for mothers up to a year of the mother after birth, in terms of supports for mothers and support services, these are striking opportunities to lean forward in terms of bringing services. Now, of course, workforce has to be built to meet those needs. But the policy landscape has opened up the opportunity for creativity in local communities and in states in terms of moving these efforts forward.
I would like to add, I'm a political scientist, and when I hear universal, there are two ways that we think about that. We think about universal eligibility, so we're removing a bunch of requirements and targets from policy design, but then we also think about no-touch policies. So policies that require very little effort to access. And I would challenge the notion of universality, universal programs with regards to the ways that we build relationships with families through the state. I think that we can do better than a no-touch program for low-income families. I actually think I love the WIC program because I think that they've done a really great job of figuring out ways to develop supportive, positive relationships with WIC parents. I think the same is the case for childcare providers. I wrote a book on childcare providers, and you will hear parents talk about their beloved daycare teacher or director. is there a way that we can build programs where the interactions aren't negative, the interactions aren't cumbersome, but they're actually supportive? So I think this is a charge for policymakers to figure out how they can shift their programs as it becomes more generous, as there's political will to provide more generous and accessible programs, shift their programs to have a more supportive personal touch as opposed to an administrative gatekeeping design.
And I'll just quickly echo everything that's been said, and add to that the child tax credit was extremely unique, and is really worth reflecting on and thinking about whether there's a way through different coalitions to build will for that to become permanent. The truth is that raising children is expensive. It takes money. And we are one of the only wealthy nations that does not provide public support for that very important endeavor, as those children are the adults of the future who are going to support all of us in our old age. And thinking about, again, coalition building around efforts to revisit the child tax credit would be an important complement to the other things mentioned by the other panelists.
Well, thanks to all of you. I think now we're going to take some questions from some of our participants. Heidi Carter said, great presentation. Local governments are receiving unprecedented funds via ARPA, which policymakers hope to use in transformational ways. What recommendations would you have for how to use these funds to best promote enriched communities for children or for families and children that provide universal services and support for early relational health?
I'll start off, but I'm sure others want to lean in, and certainly it's an incredible opportunity with dollars coming to local public health communities. And how does one then engage building a workforce of community health workers, doulas, and navigators to link directly with community, with the medical homes? Those opportunities for deepened communities, hiring and training community health workers and navigators for the support of young families is an opportunity right in front of us. There are some states that are starting to lean forward in that kind of effort, but that's a unique effort to be thinking about the ARPA dollars to build a relational health workforce at local and community levels to counter the disparities that families have by linking social networks of connection will be really important.
Okay, thank you. Anybody else want to sort of weigh in on Heidi's question? I can reread it if that's helpful.
No, I would just, I totally agree with David. I would just add that I think this is a really important opportunity because there's so much flexibility, right? We saw that that government can move, but would also just remind folks that it's really important to make sure that we're talking to families about what it is that they need and how they want to receive it. So I think that all of these things are important, but one of the things we should be trying to do is figuring out how to make access easy for families, and with all of the flexibilities that exist, I think it's an opportunity.
I would add to that that counties or local governments should examine the uptake or the coverage rate of all of the assistance programs within their county. And if there are gaps, like if you know that only 70% of those who are eligible for SNAP in your county are receiving it, invest in outreach, utilize navigators to connect families to programs. We know that the WIC coverage rate has been between 50 and 55% for a long time. And if you know in your county that that's the case, figure out ways to reach those families that aren't benefiting from these policies.
Okay, I'll move on to, thank you. I'll move on to another question. Deborah Pacciano, I hope I'm saying your name right. She wanted to direct this specifically to David, but to say, can you please talk specifically about the most common policy barriers to creating a universal system of care as the CSSP document lays out?
I think the most significant barrier is for the Medicaid health system to in fact have a child well-being commitment. Certainly from CMS, then to most Medicaid offices have strong commitment to early childhood and to family policies. When it plays out at Medicaid in the MCOs, there is often not sufficient leadership at MCOs to focus on the needs of youngest families. So those are really advocacy opportunities for at the local level with local Medicaid organizations to really move forward in terms of relational health work as well as universal effort. The other policy barrier I would say is the support of family-led organizations to partner to bring the family voice into transformational effort. That is not a strong enough yet policy leadership to bring family voice into health system redesign and universal system development. There are many others, but what's more important is the opportunity is there for linking systems, and there are policy opportunities in order to be able to do so.
Thank you for that. I thought we'd just ask one last question from our participant. Rachel Kaplan asks, just broadly to all the panelists, how do we ensure that when programs and policies are provided funds to expand, they will continue to receive those funds? So essentially, she's talking about sustainability planning. That's always the hard one. Does anybody want to comment on that?
I mean, one of the things that I would say is that as localities and states are using their ARPA funds, they should start to have conversations and plan around how they're going to continue to fill that gap when those ARPA funds go away. I would also say it's a great time to start to put together how you use your ARPA funds. What are the positive outcomes that you got from that? What are the stories that families and providers can share? And then share those with your elected leaders. I mean, Congress is working on a budget right now, right? We're going into the summer. We've got reconciliation in the fall. Like, now is the time to let your elected officials know what you're going to need when these ARPA funds are coming to an end. So better, soon start to talk about it sooner rather than later.
Well, I think we're about out of time, so I just wanted to extend a big thank you to Dr. Gaston-Hines, Dr. Barnes, Ms. Fuentes, and Dr. Willis for a terrific session. Thank you so much for participating, and to everybody in attendance. Next up, I'm supposed to tell everybody that we're going to have a short break. And during that break, they're encouraging you to go check out some of the materials that are in the expo section. If you haven't already done that, that should be on the left-hand side of your screen. You should be able to access that. There are booths with more information about some of our speakers and some organizations that are represented here today, and some student presentations as well. So we hope that you'll take a minute to look at some of those. After the break, I will be followed by our keynote discussion, which is entitled Rooting the Work of Early Childhood Education in Equity. And that session is going to begin in about 10 minutes. So we will be seeing you again soon. And again, thanks everybody for participating.